It's live.
So live on Facebook?
Yes.
Instagram. Okay. Perfect. So this week we've had a little bit of a hiccup with the YouTube live. However, we're going to go ahead Facebook, Instagram and do a good job this week. So this week we're talking about back pain, and I'm going to run through a little bit about what causes back pain, sort of in its all-encompassing. We'll try and give a full explanation of what is actually causing it, and from all points of view, how that affects your body, and then more importantly, what we do from a treatment standpoint to oppose some of those issues. So the first thing is, this is your spine. It's not yours, but it's a spine, similar size, and its primary role is to allow your body to effectively move around the place by dealing with and opposing the forces of gravity. So your body weight comes up and down the spine, and it's got these nice little curves in it, particularly with reference to the lower back to absorb shock. Now you'll notice the lower back, the vertebrae, the bones are bigger than those in the neck because it's designed to take the weight of the body on a day in, day out basis and deal with the impact that comes from when you're running and walking around the place. Just as a side note on this week, headstands. The size of these vertebrae is substantially smaller, so putting excess pressure through your neck, possibly not the best idea if your whole body weight is going through there. Anyway, coming back to the lower back, your back is required to have support from the muscular structures that come around here. And when your back or your spine fails to deal with these loads, you start to get back pain. And quite often this will start building up over a period of months or years as stiffness, discomfort in this lower back area. It can sometimes go down the legs, etc. And that stiffness is some form of inflammation around these joints in the lower back. It can comprise of the discs, you might have heard of slip discs, herniated discs, etc., or just a general strain to the outer fibrotic layer of the disc, the annulus fibrosus. It becomes strained in minor ways from sitting for too long, repetitive stress on the discs, particularly down in this bottom section. But fundamentally, it's a failure of that part of the body to deal with the compressive load of gravity that it was designed to do. And that stiffness starts to lead to an element of rigidity. Other joints become stiff up here, perhaps in the thorax, where you're sat at a desk all day, etc., and the ribs just don't move. And then when you get up and move around, the lower back starts to get strained a little bit more. And these things all start to build up until you get an episode of back pain. And the consequence of back pain, which is one of the main reasons that it's so frequently initially misdiagnosed as a quote-unquote muscle spasm, is the way in which the muscles around here and in the glutes work, in this section of the lower back and in the glutes work, is to support and protect that area in the lower back. So when you strain one of these little joints down here, you're going to get a muscle spasm in the glutes and in the lower back muscles as well, and sometimes symptoms down the legs. Now that muscle spasm is somewhat unhelpful because if it's a compression issue, too much compression has caused the injury, the spasm and the contraction of those muscles is going to stiffen everything up and compress it further. And you typically go to your relevant practitioner, GP normally, and they'll say you've got a muscle spasm. And muscle spasm is just not the full picture. You do have muscle spasm most likely, but it's not what's causing the muscle spasm. And therefore, getting to grips with what's causing that muscle spasm, that failure of this section of the lower back to deal with the compressive load, and subsequently getting a trauma or an injury or damage to soft tissues, is what's causing the muscle spasm. Then we can also get an element of radicular pain, so pain from the nerves. The nerves get irritated because of a buildup of inflammation. Commonly this can be called sciatica in the lower back when it travels down the back of the leg. Don't get confused, because sometimes you'll go to the GP and you've got pain on the front of the thighs, and that's something different. The sciatic nerve does not go on the front of the thighs. So if you've ever been diagnosed with front of the thigh pain and they call it sciatica, they don't know what they're talking about, or they're trying to put that in layman's terms, pain down the leg, and they're trying to oversimplify it. But you understanding exactly what's going on is quite important to your recovery, because you're living with your back every day. So just to recap so far, you've got a failure of your body to deal with the fundamental task the lower back has, which is resist compressive loading without getting injured and absorb shock and stress and strain on a daily basis. And that's failed somewhere, that compression. And that's caused some sort of injury to the structures. It could be the facet, it could be the discs, it could be the small ligaments and muscles in and around this area. But in reality, it's more likely a combination of all of those in some way, shape or form. In more severe cases, there might be some element of bony damage as well. And then you also get that degree of rigidity and stiffness, stiff points elsewhere that are causing excess pressure to go through those injured segments, which is one of the reasons that they get injured and the soft tissues become damaged. And then you also get that muscle spasm that just makes things a good deal worse, especially if it's persistent. And the treatment that we do here, moving forwards into that, is
our main goal, we have different technologies that we actually use together, and you can watch many of our videos on the website or read more about the technologies, to oppose each of those main problems, the 4 main issues. And we combine this process, we call it the Mayfair Method here. But it's fundamentally approaching each one of those conditions, or each one of those issues at the same time, with the addition of rehabilitative exercises to specifically guard against further occurrences of that by strengthening up the muscles around that support the lower back and support the legs, so that you're at less risk of straining those muscles in the future. Now, the first thing is doing some vibration work. Okay, the vibration is an extremely effective way of treating these muscles, easing some of the muscle tension that's going through them, decreasing some of that muscle spasm around this section of the back up to the mid back, as well as lower down the legs. If your hamstrings are in spasm and tight and shortened, you're going to pull on the lower back, and that's going to aggravate and irritate these joints down here, which are probably already injured if you've got pain down here. So doing that vibration on those muscles is extremely effective, and it's painless. Sometimes it's a little bit ticklish, but working on either side of that lower back, as well as on the lower back itself, does help with the muscle spasm. But that's in some ways the least important part of the equation. We do it anyway though, because it feels nice and it helps. The next part is getting some of these joints again away from the injured site to start moving better. So we use some joint adjusting instruments to safely get these joints moving. And that's not the same as manipulations, which we've done in the past. It's a little bit more specific and a little bit easier on the patient to have done, and quite often it's actually quite pleasant overall, and it doesn't involve any twisting or any rapid movements. And that gets these moving so that this bottom section of your lower back has a little bit less stress and strain on it. And all of these joints should move nicely. So when you start to get hinge points that don't move as well as they should, other sections take wear. So getting them all moving nicely again is super, super important. And then we move on to the more specific work. We said there's an injury down here, and that's what's causing your pain in most cases. You can get into pain being in the brain and all that sort of stuff, but we're not going to talk about that today. We're going to focus on the actual injury, because when you do have an injury, as a patient, being told the pain is just in your brain, you need to go away and think about it, is not particularly helpful. I'm not a big fan of that, even though you will hear a lot about it. Sometimes people just have injuries and they need help. So doing some work over the injured site to actually get that to start healing better, to decrease inflammation locally, works very well, and we use our laser for that. It works extremely effectively, and within reason, no matter what's going on down here, it's safe and effective to do and helpful, and it's very, very pleasant for the patient to have done. Involves no movement, especially those acute patients that can't move because the pain has been left to run and get so severe. It's very, very pleasant. And then finishing it all off, opposing that failure of dealing with gravity. And that's the decompression that we do here. And that's gently taking the pressure directly off this section of the spine and just pumping these discs here. Now, decompression is primarily done for the discs, but you can improvise its usage to help with other sections of the spine as well. And that's the direction of the pull, etc. But that takes that pressure off that spine. So you've addressed all of the facets of the problem, rather than just trying to do one thing or twist one joint or do some massage work. You're being much more encompassing, and then providing some comprehensive rehabilitative exercises and or stretches that are progressive in nature to make sure that that pain heals better, your body deals with gravity better, your muscles aren't in spasm, and your joints are moving well, and you're stronger and more effective at dealing with those loads in the future. And that's pretty much it for back pain. You've probably seen us say some of that sort of stuff in the past, but that's just a sort of a nice way of sort of rounding the whole thing off to give you a good idea of what's going on with your back, how it can fail, the most common way it can fail, and then what you can do to help it. So I hope that video has been interesting for this week, and we'll see you again next week. Bye.
Thanks for taking the time to watch this video. For more great videos, we've got one here, which is the Back in Shape program, and explains how you can strengthen your back from home. Up here, we've got some of our recent uploads, and don't forget to stay up to date with our latest live videos and new uploads. Subscribe by clicking above. Thanks again.